So welcome all. The MfPH Next Generation Seminar Series is a networking event for early career scholars, juniors, mothers, and epidemiologists working on or interested in mathematical modeling of infectious diseases and other threats to public health. Bienvenue à tous. La série Séminaire MfPH Next Generation est un événement pour les chercheurs en début de carrière, les modélisateurs juniors, les épidémiologistes travaillants ou intéressés par la modélisation mathématique des maladies infectieuses et d'autres menaces pour la santé publique. First of all, we wish to acknowledge this land on which the Fields Institute operates for thousands of years. It has been the traditional land of the Huron-Wendat, the Seneca, the Mississaugas of the Credit. Today, this meeting place is still the home to many indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. Premièrement, nous souhaitons reconnaître cette terre sur laquelle l'Institut Fields opère depuis des milliers d'années. C'est la terre traditionnelle des Huron-Wendat, des Sénèques, des Mississaugas. Aujourd'hui, ce lieu de rencontre abrite encore de nombreux peuples autochtones de toute Turtle Island et nous sommes reconnaissants d'avoir l'opportunité de travailler sur cette terre. Our guest today is Professor Jacques Bélair. He's a full professor from Université de Montréal. He has PhD in applied mathematics from Cornell University and he was a postdoc fellow at McGill University. He has served as Associate Director of Centre de Recherche Mathématique and Vice Dean of the Faculty of Graduate and Postdoctoral Studies at Université de Montréal, also President of the Canadian Applied and Industrial Mathematics Society. Notre invité aujourd'hui, c'est le professeur Jacques Bélair, professeur titulaire au département mathématiques et statistiques de l'Université de Montréal. Il détient un doctorat en mathématiques appliquées à l'Université de Cornell et il a été postdoc à l'Université de McGill. Il a été directeur associé Centre de recherche mathématique et vice-doyen de la Faculté des études supérieures postdoctorales de l'Université de Montréal, ainsi que président de la Société canadienne de mathématiques appliquées et industrielles. Today's talk will be on modeling the use of Fangsang shelter hospitals in Wuhan. La présentation d'aujourd'hui sera sur modélisation de l'utilisation des hôpitaux refuges Fangsang à Wuhan. Thank you very much, Professor, for attending this seminar, and the floor is yours. Thank you.
Thank you very much for this nice introduction. So what I would like to do today is present some work that I was involved in that involves a particular very aggressive technique of control that was used in the early stages of the epidemic in Wuhan, in China, and present, in a sense, what realistic modeling exercise involves using real data, and then I will present some more mathematical aspects of a simplified version where we try to develop techniques of dynamical systems that can be used to understand some of the properties of the model, more mathematical ones. But first, I would like to be quite unusual in my presentation, and first remark that the 19 in COVID-19 is the real number, because as was mentioned at a recent workshop at the Fields Institute by people from the Blue Dot company, there were signs in late 19 of what was called unusual respiratory symptoms that were observed in China. And also, this is from the website of a Montreal University hospital, where a new infectious disease, which is not clearly understood, has been observed, and this is January 2020. And the tracing can be made to the same markets in Wuhan. And so, as I mentioned, first I'd like to look at a different perspective on the SARS-CoV and COVID-19, some unusual things that happened at the beginning of the pandemic in the spring of 2020, and some consequences of this very unusual, because there were so much consequences in the general society that it's interesting to observe what the effect of this COVID epidemic have been. And the first is a rather unusual penetration of consideration of the COVID. And one aspect that was not completely clear at the beginning is what was to be done and what kind of interventions were to be derived. So many general media were looking at comparisons between different countries, and as this title page indicates, try to determine what is working elsewhere, since this is a French magazine. And a few months in the pandemic, people were looking back, and this is after the vaccines were developed, and asking what has gone wrong. So very early, people were looking for strategies, and really further down the line, very soon down the line, we're looking at what was working and what was not working. So at the beginning, there was this strange association between coronavirus and the beer that's called Corona. And this was a very quick and very short-lived attempt at dark humor from a shop in Belgium, where there exists, and that's real, there exists a beer called Sudden Death, called Mort Subite. And so they had this very strange promotion that if you buy 2 Coronas, you get a sudden death. And very quickly, the brewery itself shut down this promotion. So this was taken from the internet in the few hours where it did exist. And another interesting development that occurred is, how do people deal with the lockdown? So of course, as you all remember, the only strategy in the absence of vaccine was to have what was first called social and then became physical distancing strategy, so isolation, and people asked to remain at home. So what do you do when you have all this time on your hands? Well, you can look at movies, and movies on pandemic in particular. And this is in the mid to late 2021, some psychologists made some people from human development, psychology, English, looked at the effect of looking at pandemic movies, and it's actually beneficial for you to look at pandemic films seen as a function of preparedness, and both psychological and general preparedness. And you see a decreasing preparedness as the number of movie that one has seen is decreasing. So it is useful to look at the pandemic movies during a pandemic. And in fact, I gave a semi-serious talk, and well, maybe less than semi-serious talk on this notion a few months back at the Fields. And some of these movies are quite creative, and one in particular uses language as the vector of communication of the disease. And one interesting from a Canadian perspective is that the language that the infection is propagated is English only. So one preventing measure in this case is to speak French. And this is detailed. And at least in the English language, it's shut up or die is a prescription. And also from a Canadian perspective, historically, there's another movie which has a more historical perspective on the Black Death, and this movie is situated in England, and there's a certain view from French people in France from that point of view in the Middle Ages. Be that as it may, it became very quickly obvious that there was a race against time, as is displayed in this May 2020 issue of Quebec Science, which is a popular magazine in Quebec. And in fact, as became obvious in the following months, COVID-19 was the glorious hour of modeling. And in this, so this is from the website of the magazine, it became clear that modeling was to be used as a way of planning and devising control strategies for the pandemic. And one, as I mentioned, strategy that was used in Wuhan at the beginning, this is February 2020 of the pandemic, is the use of the what are now called Fangsang shelter hospitals, which are a special type of facilities. And if you remember, so there's a operation and construction manual, which is available on Amazon. And in fact, what happened was that there was a quick construction boom in Wuhan to devise what were then called observation wards. And these were facilities to isolate people who had tested positive for COVID. And these were built very quickly, and they're really quite simple arrangements. And it's really observation and almost a containment, and to a certain extent, storage facilities, storage of patients. So these were devised to isolate patients and observe the transition in the pandemic of their status. And so what I will be presenting is part of the content of this article, which was published in the journal, the Bulletin of the World Health Organization, and describes how useful those what are now called Fangsang shelter hospitals during the pandemic, especially the initial stages. And so the kind of things we are trying to model is a combination of the number of confirmed cases, which are the stars, the occupied beds, and the new cases in healthcare personnel. So I'll make a difference between patients who are healthcare workers and those who are not. And also the number of occupied beds, because these are the one of the limiting properties of possibilities of controlling the pandemic. And in fact, these occupied bed in Fangshan Hospital only start on February the 5th, because this is when the first new hospitals became operational. So these models are considerably a more complicated version of the classical SIR model. So I believe that this audience is very familiar with the SIR models introduced by Kermack and McKendrick in the 1920s. So one first variation on the SIR model is to have an SEIR model, so the exposed. But in this case, given the nature of the disease, in the case of COVID-19, given also the properties of the different patients, either as patients or as exposed to patients or healthcare workers, in hospitals, healthcare workers in these specific hospitals, we ended up with a sizable number of variables. So we have the susceptibles who are not healthcare personnel, susceptibles who are healthcare personnel in designated hospital, and exposed classes in each of the equivalent classes in each category of personnel. So exposed who are not healthcare personnel exposed who work in designated hospitals, and asymptomatic people, either not healthcare or healthcare personnel, and infected. So asymptomatic people who are not healthcare, untreated asymptomatic, and then recovered without entering the hospital, and those have to be contrasted with recovered from designated hospital. So there's a fair number of variables that need to be deployed, and these are illustrated in this schematics. So we have sort of an SEIR model inside the hospital and an SEIR model quite sophisticated outside the hospital. So we have people with mild symptoms developing stronger symptoms. Some of them will have to be hospitalized. So that's how they end up in the hospitals. And then they interact with the the healthcare workers inside the hospitals. So some of them become infected and recover, asymptomatic, or these will be exposed to the susceptibles. And so in equations, this becomes this, one can say, involved system of equation. So we have a model equation for the non-healthcare workers outside the hospitals, and then the care workers inside the hospitals. So the transitions are the one that one usually observes, susceptible become infected, and so the exposed are infected and so forth. And they finally recovered after being infected. And one of the properties is the number of beds that are available. So to alleviate the pressure on the hospital beds in designated hospitals, so those patients with severe symptoms were taken to hospitals, especially with respiratory distress. And so the decision was taken to increase the capacity of hospitals, and this is how these new Fangsang shelter hospital were designed. So to differentiate between the regular hospital and the Fangsang shelter hospital, we have to introduce new variables corresponding to this physical location. So we have, once again, susceptible, exposed, asymptomatic, infected who will develop symptoms and recovered inside the Fangsang hospitals. And so we need for that a third physical location. So in addition to the designated hospitals, which are the regular hospitals, there's what were originally called observation wards. In French, now the terminology is hôpitaux de campagne. And these are the Fangsang hospitals. So at this point, the infected individuals were mainly sent to these observation wards, the Fangsang hospital, in addition to the regular designated hospital. So there's an increase in the capacity of hospitals to treat patients with severe symptoms. And if we compare before and after the Fangsang hospital, the main difference is that, as I mentioned, the very severe patients with severe symptoms are sent in large part to the Fangsang hospital as infected. So we get a similar equation in the continuity. So we have the same equations for non-healthcare personnel, healthcare personnel in regular or designated hospital, and we have to add the model for the healthcare personnel in the observation ward, and we get similar structure for the equation, loss of variable, and the number of hospital bed becomes a variable of concern in both cases. And finally, in phase 3, this is when hospitals stop being built. So the capacity of the hospitals, both the designated hospital and the Fangsang hospitals to admit patient is not saturated. So in a sense, the hospital capacity is now sufficient to treat all the patients. And so we also have an equation for the non-personnel. And this is the third part when there's no shortage of beds in the different hospitals. So in the phase 3, since there are less transition from the constraint of the number of beds, one can then use the dynamical systems technique of looking at asymptotic regime, since some of the transients in a sense have been eliminated to a large extent, so the number of beds is no longer a dynamic variable. So we can look at the disease-free equilibrium, which has susceptible and recovered in each of the 3 categories. We can compute the basic reproduction number, which this audience, I'm sure, has been exposed to quite a number of times. So in this case, the basic reproduction number, as happens, well, not often, but frequently in modeling structured and models with subclasses, this reproduction number for the whole system is actually a maximum of 3, one can say, sub-basic reproduction number for the patients outside the hospitals, within the designated hospital, or within the Fangsang hospital. And each of these reproduction number, as is usually the case, will depend on contact rates and duration of infection in each of the subcategories. And we can devise an instantaneous risk index, which is from this calculation in the 3rd phase, when there's no more deployment of the Fangsang hospital and the bed capacity is at 10, we can retrofit the same formulas for the instantaneous risk index in the transition parts of the pandemic. So T2 is the beginning of the 3rd phase, when there's no more construction and the bed capacity is not of concern. And so in this case, we get a more time-dependent risk index. So if we look at some of the data that were observed, so comparing the model with the data that were observed in Wuhan, say from January to March in 2020. So this is the very beginning of the pandemic. So the number of cases in the thousands, comparing the fitted data to observed data. So you may remember that there was a change in methodology of computing cases in China in February of 2020. So this jump is basically a methodological artifact. And this is the number of deaths. This was the number of cases, and the number of deaths is also fitted with the actual data from the model. So looking now at different scenarios, so one of the advantages of using a mathematical model is to be able to look at 3 different scenarios. So one of the advantages of using a mathematical model is to be able to look at 3 different scenarios. So one of the advantages of using a mathematical model is to be able to look at 3 different scenarios. So one of the advantages of using a mathematical model is to be able to look at 3 different scenarios. So one of the advantages of using a mathematical model is to be able to look at 3 different scenarios. So one of the advantages of using a mathematical model is to be able to look at 3 different scenarios. So one of the advantages of using a mathematical model is to be able to look at 3 different scenarios. So one of the advantages of using a mathematical model is to be able to look at 3 different scenarios. So one of the advantages of using a mathematical model is to be able to look at 3 different scenarios. So one of the advantages of using a mathematical model is to be able to look at 3 different scenarios. So one of different possibilities of changing variables, changing parameters, and looking at time difference or time scenarios of when different measures are implemented. So in this case, the number of daily cases is investigated under different scenarios. So starting in January all the way to August. So from over this 7-month period, basically from January to August, mid-January to early August. So if we look at the actual data, so the actual number of daily confirmed cases, if we look at different opening dates of the Fangsang Hospital, so comparing the real data with possibilities of having these openings taking place slightly before, so a week before, 2 weeks before, a few days before, or the following day, as opposed comparing to the actual date of the 5th of February. And we see, as one would expect, that the longer we wait before opening, the more cases there will be until the actual number of cases. And more significantly, or more spectacularly, I would say, if one day postponement would have given rise to quite a sizable increase in number of maximum cases of confirmed infection. So going from around 40,000 to slightly above 2 million cases. So this is an illustration of exponential growth. And here one has to be careful about interpreting the graph itself, because this line is actually with these scale. And so this is why this curve on the same scale would really be much smaller. And this is the number of the bed use. So this is number of the bed use as compared to number of daily cases, and we get a similar situation. And this is implementing the number of beds, as I mentioned, which is a significant factor in controlling the pandemic. The bed capacity, if it had been increased as opposed to what it was in reality, the number of cases would have been decreased. And if the number of beds had been decreased by 20%, then there would have been a essentially similar kind of increase in the number of cases just by the bed capacity being reduced. And here we have, in the absence of the shelter hospital altogether, the transmission rate would have been significantly higher, and the number of cases would have also increased if the absence of Fangsang Hospital would have produced much more intense transmission between susceptible and infected. And the cumulative number of deaths would also have increased significantly using the same changes that I illustrated before. So different opening dates, as I mentioned, postponing by a day would have increased the cumulative number of deaths and the cumulative number of as a function also of the number of beds. So this is the opening dates of the Fangsang Hospital, and this is the number of beds available in the Fangsang hospitals. And this is the equivalent of the last two graphs in the first part with the transmission rates. And so we use a table representing the number of, so this is the actual number that were illustrated previously. So this transition from a few dozen of thousands to millions of cases is clearly illustrated. So the peak case and the total number of infection and the total number of death was significantly decreased by the use of the Fangsang Hospital. So this was a retrospective look at the data and trying to understand the actual efficacy of these measures. So what we then proceeded to do is look at the mathematical techniques and a more mathematical analysis, less concerned about the data itself, and trying to understand some of the properties of the model and the mathematical properties themselves, and particularly looking at the delays taking place in the structure of the model and what the dynamical consequences of these delays might be. And so what we did with a different subset of the collaborators in the initial study, we look at a much simplified model. So this is SEA, so asymptomatic, SEII, so I sum of distinguished by the severity of the symptoms, so hospital and then recovery. And once again, to understand the effect of the Fangsang hospitals, we looked at the structure of the model without those hospitals and with these hospitals. So these hospitalized patients were divided between regular hospitals and the Fangsang hospitals. And we wanted to introduce this bed capacity as a function of the time it takes to be admitted to hospital in both of the regular and Fangsang hospital. So one of the defining parameters that limits the capacity of controlling the pandemic is the number of available beds. And so the effect of having a limited number of available beds is to induce a waiting time before admission in either the Fangsang or the designated hospital. And so this waiting time is computed as a function of the transmission rate and the recovery rate, and depends on what's happened from the beginning of the diagnosis and the extent to which these infected patients can be admitted in hospital. So the number of hospitalized patients become the number of infected sometime in the past times this weighting, this weighted term representing the time it takes for admission to take place in hospital. And the recovered patients are the ones coming from the hospital with different recovery rates. And if we add the Fangsang shelter hospitals, then we need an additional compartment for these Fangsang hospitals. And now the recovered individual, for example, will be a sum of the original patients from the hospital plus the new ones from the Fangsang hospital. So we can do a comparison between these two models corresponding with these two block structures with two types of hospital or a single one. And this is what we did, but we had to do a further simplification first without the Fangsang hospital and look at the simplified models with constant delays. So assuming that the waiting time was a constant, which does simplify the integral term, which becomes an exponential term. So not entirely easy to deal with, but manageable in a mathematical sense. So with this constant delays, in the absence of Fangsang hospitals and with Fangsang hospital, we get these simplifications of the original equation. So for this equation, we can use the mathematical machinery of looking at asymptotic behavior. So we get the Z3 equilibria. So we're looking at two different systems, with and without the Fangsang hospital. So the susceptible, the Z3 equilibrium, as is to be expected, is composed entirely of susceptibles. And we can use the next generation matrix method, which I'm sure has been alluded to previously in this seminar series. And we get the so for the next generation matrix, we need two matrices, a transition and a survivor function, so F and V. So the V matrix in this case is a combination of three quite structured and one can say sparse matrices. And so the radial spectrum of the FV-1 matrix can be written as a combination of course, the initial level of the susceptible population, and also a combination of the dynamical parameters in the transition equation. So both for the case of the system with Fangsang hospitals and without Fangsang hospital, we have an explicit expression for the spectral radius. And as is the case, we get a condition from this R0 for the Z3 equilibrium to be stable. And in this case, we can show that it's not only stable, but also globally stable. And this stability can be established by characteristic equation, which, since we are dealing with a system with delays, will involve a number of exponential terms containing the delays in the equation. So we can do it for the endemic equilibrium. So this was for the C3 equilibrium, and we have to then address the endemic equilibrium, and we get this dichotomy that the endemic equilibrium would exist when the Z3 equilibrium is unstable. And as I mentioned, the Z3 equilibrium is not only locally, but also globally stable. We can construct a Lyapunov functional to ascertain the stability of the Z3 equilibrium. So loses its stability, there's an endemic equilibrium, and the stability of the endemic equilibrium will involve this complicated characteristic equation, the analysis of which follows the same line conceptually as one would do ordinary differential equations. It's the algebra which is more involved because of these exponential terms. But we can also find sufficient condition for the stability of the endemic equilibrium as a function of many of the parameters. So combination of these coordinates of the endemic equilibrium, some of the transition parameters, some of the contact rates, duration of infection in each of the different regimes. And we can also get estimate or from the literature of all of these parameters that do occur in the equation, including the average waiting time of the severely infected patients in both the case with and without the Fangsang hospital. So, as is to be expected, the waiting time is decreased when the Fangsang hospitals are introduced. And the average infection rate is also decreased in the presence of the Fangsang hospital. So at least the direction of change of the parameters is what is to be expected, but this also allows for a quantitative estimation of how these changes do occur. And so we can, as we did before, look at the number of, compare the real data with what our model predicts in terms of confirmed cases, deaths, recoveries, and the number of beds available. So this illustrates the real data as the contraction was taking place. So the stepwise meant new wards and new hospitals were, new hospital facilities were introduced. And the impact of the Fangsang hospital, the number of cumulative cases, so we can see what the model predicts in terms of the effect of this isolation and reducing significantly the number of cases and the number of deaths between when they were deployed to the end of February. And we can also do a heat map as a function of these parameters to delay and the admission time, and look at the peak size, looking at the effect of comparing these two delay in admission to the regular hospital and the Fangsang hospital. And this red dot corresponds to actual data that was observed. And we can also look at the elasticity of R0. So how sensitive is the value of R0 to changes in some of the parameters? And this is done by computing derivatives of the R0 with or without Fangsang Hospital with respect to so the relative derivative with respect to the parameter we want to look at. So either tau 3 or tau 4, which is the delay for admission due to lack of hospital beds in either the regular or the Fangsang hospitals. And we can see that this elasticity is increasing as a function of the delay with respect to both tau 3 and tau 4, and that it's more sensitive to delays in the regular hospital as opposed to the Fangsang hospitals. And this is another measure of the relative contribution of the regular or designated hospitals and the Fangsang hospital, where we try to look at the relative value in specificity. So what is the relative ratio of weighted waiting time of one with respect to the other. And we also can identify the actual data from the pandemic. And so, as I mentioned, these results are described in this article from the Bulletin of WHO. And the last part, the mathematical model, is in SIAM Journal of Applied Math. So as we traditionally were saying, is in the press. Well, that's the electronic press nowadays. So we just had the final version to look at the last few weeks, and it should be available online shortly. So this is one example of some of the work that I've been involved in within this network, the Math for Public Health, that this seminar series is a part of. There's another network called Omni, and even before Math for Public Health, it was a CIHR, Mathematics of COVID-19 network. And so that's a combination of the kind of work some of us have been doing in these networks, which is both integration of data, observed data, trying to understand and guide interventions, and also from the mathematical side, looking at the basic properties and the structure of some of these models, oftentimes in more simplified versions, to do the more complete mathematical analysis. And these two type of approaches are complementary, and hopefully they feed mutually one from the other. And this is what I wanted to say today. Thank you.
Thank you very much, Professor. So it's time for questions. If anyone have any question, you can drop it on the chat, or you can unmute yourself and ask it. So for the first question, it was dropped in the chat from Dr. Mohammed Khalifi. I'm just wondering whether you investigate what would be the outcome if the isolation centers in Wuhan were opened one day earlier.
In fact, this is almost what I have in one of the graphs, because what's spectacular is one day later is 10 times more cases. And yes, so here is not one day, but 3 days before. So this is the curve. Because so this is dark, lighter. So that's January 23rd, January 30th, February 2nd. So February 4th would be somewhere along this line, with a maximum between this. So that would be one day earlier.
Actually, I have another question. If the infection time were bigger for the case of another infection other than COVID-19, so how it will impact the use of hospital shelters?
If the infection time?
Yeah.
I think the same approach could be used, but if the infection time is longer, then the demand for isolation will be increased because each patient is sick longer. And so the bed capacity would be attained earlier. So I think it would be a matter of having to build more, or the transition to having sufficiently many beds. If all the other parameters remain the same.
So in terms of modeling, how can we in fact like the loss of immunity for this one? I think it's for the short time. For the long time, if we want to include the loss of immunity or mutants in the modeling, how can we describe them in a mathematical way?
Well, what you have to do is, in the simplest case, I go back to my diagram, even the simplest of all simple cases, you have to do from recovered to susceptible again, right?
And for the mutations for the infection.
Yeah, okay, so you mean looking at different variants, or?
Yeah.
Okay, well, so what you have to do is, so one way is to stratify the susceptible according to the variants, and then you could have different parameters, the infection rate, duration for each of the variants. The other way is to assume that you only have one variant at a time. And so once you've recovered or you've been vaccinated, then there's a waning of this protection. And you try to introduce in the description of this waning mechanism the properties of the new variants. So transmission rate, probability of having severe symptoms, and so forth. So you can do it either in parallel with the different variants, and a patient would go along the flow and be re-injected, and then would have a possibility of following a different path. But the major complication is really to have the susceptible being, so when one considers SIR model, those are much simpler than SIRS. And the time scale, I think, is a crucial element. As you mentioned, the analysis we're doing here is more of a short time scale, a single infection. And so the re-injection is not so, I mean, this, roughly speaking, that's the difference between pandemic and epidemic, or when people talk about the disease stopping becoming pandemic and becoming just an epidemic, but it's very, and those terms are not always used in the proper context and don't mean the right thing, the same thing for all people. But the re-injection is an additional complication, and this is not at all what we are addressing here.
That answers my question. So, is there any other question? So, thank you very much, Professor, for this great talk.
Thank you for having me.
Okay, thank you. So for the next seminar, it will be for people who likes football or soccer. It will be a mathematical modeling for COVID-19 regarding the World Cup and 8th February by Dr. Martin Grunin from Public Health Ontario. So thank you very much, Professor, and see you in the next seminar.
Okay, thank you.
Oh, seems we lost Idris. Hello.